Good evening, everybody, and welcome to tonight's Fireside Chat with me, Dr. Binita Kane, and Helen Oakley, patient, advocate, and founding member of Long COVID Support, which is our partner charity. Tonight, we are going to be talking all about the gut microbiome with our amazing guest. This is live and interactive, so please feel free to put your questions into the chat and we will do our best to get to them. And if you can't stick around for the whole hour, don't worry. It is going to be recorded and posted immediately afterwards for viewing in our YouTube channel. So at this point, I will say bye to Helen and pop her backstage, and she's going to be joining us later for the Q&A, and she'll be keeping an eye on the chat as we go through the evening as well. So let me do that. And without further ado, it's a real pleasure to welcome our guest for this evening. It's Rachel Jessey, who is a registered nutritionist with a master's degree in personalised nutrition. She's been in clinical practice for just under 14 years, supporting many different health conditions, but has developed a special interest in long COVID since 2020. So welcome, Rachel. Really great to have you here this evening.
Hello, can you hear me okay?
Hear you perfectly well. So Rach, we sort of originally met through my very good friend and colleague, Dr. Asad Khan, who many of you will know is a very prolific advocate for long COVID. And he's given me permission to share that he actually consulted with you, and he said to me, "You've got to meet this woman because what she doesn't know about metabolic pathways is not worth knowing." And it really kind of, when I sort of had, over the years as I've got into this space, I've realized how little we as doctors get taught about nutrition. We get taught virtually nothing. And the science has exploded around the gut microbiome over the last 10 years, and mainstream medicine is really quite far behind. This is a really fascinating area, and it's been a real pleasure to work with you, and you've worked with a number of my patients. So I thought we had to get you on, and I'm going to shut up now and ask you a little bit about yourself and how you got into this space.
Oh, well, thank you so much for having me on your platform and giving me an opportunity to speak to your followers. It's great to kind of bring these new concepts to people. And, I just want to kind of caveat that I'm not saying that this is a cure or anything, but I do understand from clinical practice, not only since long COVID, but kind of previous clinical practice, that the gut health is pivotal to kind of improving recovery. And so I got into it really as part of my education. So the microbiome in kind of the nutrition world was kind of a big area that we were studying, and that carried on in clinical practice. But it wasn't really until we had a situation where my son was hospitalized with sepsis, and he came out of hospital. Obviously, they saved his life. The care he had was absolutely unbelievable from a medical standpoint. But when he came out of hospital, it was very clear that he developed a condition called post-sepsis syndrome. And there was very little help and support out there at that particular time. So it forced me to kind of do this deep dive. And I actually uncovered this whole world of research in connection with what happens with the gut during a sepsis event, and then what happens as a person's going through recovery. And so when COVID hit, it became really apparent that there was a similar sepsis type presentation occurring in this long COVID. And so that's where I thought, right, I've seen this before in my research. So I started digging into it and putting research out on LinkedIn. And that's when I connected with a ton of experts in the area and experts in different areas, and we've all kind of come together and we're all researching together and trying to work out what's going on.
Yeah, no, thank you. And I do feel we're a little bit like kindred spirits in that way, because I've been very much inspired by my daughter's journey. You've been inspired by your son's journey, and there are some parallels in how we've got to where we are really with this. So the gut. Okay, so I was trying to look up some fun facts about the gut, and first of all, it's really long. Okay, so it's somewhere between 7 and 9 meters. of gut in all of us, and the size of a sort of double-decker bus in length, which is quite mind-blowing. And then, you know, there's this statistic, isn't there, that there's something like 38 trillion gut bacteria in the microbiome. That's like 38 with 12 zeros after it. And this microbiome, which is kind of the family of those bacteria, are really important in health. So can you give us a bit of an overview? And this is such a difficult topic, so I really appreciate you coming up and trying to make this simple. Can you explain to us kind of what is the gut microbiome? Why is it important? And, you know.
Yeah, first up, I want to say that the research in the gut microbiome, as you say, has exploded in the last 10 years. And I want to kind of caveat all of this by saying that there are really large corporations looking at the research into the gut microbiome to improve things like dairy products, to improve infant nutrition, to improve the milk that goes into bottle feeding. So companies like Danone and Nestle are investing billions into the research into microbiome and microbiome technology. And there's research looking at gene editing of the microbiome, looking at cancer therapy, Alzheimer therapy. So there is this really massive body of funded research that's going on in this space at the moment. But what is a microbiome? So a microbiome is a collection of bacteria, viruses, yeasts, and even parasites that kind of live in a community together, and they all play a specific role in that microbiome. Now, you'll also come across a term called the microbiota. So the microbiota is kind of, in inverted commas, that term that we use, or the correct term that we use for the microbial communities in a host. So our gut microbiota is what we should really traditionally refer to it, but it is just this, a collection of microbial species that all interact together, and in our case our gut microbiome can determine our health, and it can determine disease processes as well. So the majority of the research into the gut microbiome is focused mainly in the colon, but we do have microbiome communities in almost every area of our body, and it's found on our skin. So it would be, I just find that it's a hard thing to ignore, because we've learned to live with it symbiotically. So we need to consider it as part of our overall health. And so when I try to describe the microbiome to my patients, I kind of try and get them to imagine a vegetable patch. So there's all different components. So you need good quality soil. And what this represents is the health of our gut lining and the protective mucus that it secretes. And then you need to have the seeds that germinate and grow. So those are going to be our beneficial gut microbes. And you might have heard of the term probiotics. So that's included in that subset. But then you need to be able to feed those seeds the right components in order for them to grow, and the food that we give the probiotics or our microbiome are the prebiotics. And then if all of these components are in place, the seed should hopefully turn into a plant that provides additional nutrients and other beneficial properties. And our microbiome generates postbiotics, and these are in the form of short chain fatty acids and other microbial metabolites that exert beneficial or negative effects on the host.
Okay, so I'm going to just try and synthesize some of that stuff that you said. So I think first thing to think about is that actually when we talk about the gut, we're talking right the way from the mouth, aren't we? Mouth, but microbiome, all the way through the intestines, right the way to the other end. And different, you know, as you say, there's lots of research around probably the colon, but actually the mouth, nose, you know, small intestines probably equally as important. Secondly, I sort of think of the gut as a bit of a highway to every other organ, because what you ingest, the gut is the main place in which all of those nutrients are absorbed. They go into the bloodstream and they're distributed then around the body, so it can affect every tissue. And of course, there is a whole nervous system around the gut, isn't there? So some experts call it the second brain. In fact, it probably is the first brain, because it developed embryologically before the actual brain.
Yeah.
So, yeah. So and then so we think of that really complex structure that's linked intricately to every part of the body. And then we have to nurture it and make sure that that kind of garden, vegetable patch analogy you gave, that everything's balanced in the right way for it to flourish and produce goodness, if for want of a sort of a simplistic term. And if something comes along and interferes with that, that creates badness, right?
Yeah,
really simple.
Absolutely. Yeah, things can create havoc, and some of the things that can create havoc within the gut are medications and supplements. So I'm going to class medications, supplements, herbal formulas. They can all have negative consequences within the gut, the types of food that we eat, the environment that we're placed in, and also stress can actually impact the quality of the gut microbiome as well.
Absolutely. And, there's probably millions of people out there who've got irritable bowel syndrome. And that's probably now understood more as more of a kind of a neurological, gut nerve problem rather than, some of the other sort of reasons that we might have thought in the past. And again, these things are kind of poorly understood in mainstream medicine, I would say. I think a lot of the research is outside of mainstream medicine.
Yeah.
Okay, so in terms of, we'll get on to kind of probiotics and supplements and things. I think that'll be really interesting to discuss with you. But what do we know in terms of long COVID and the significance of the gut?
Yeah, okay. So there's some really interesting things going on within the research on this, and talking to researchers across the world, and obviously what we're seeing coming through in publications. So we have the concept of viral persistence going on in the gut. So many people who I've consulted with and spoken to and connected with have described these kind of GI symptoms when they've experienced a COVID event. So I do feel that this is quite a significant mechanism that's occurring within the gut. And then there's a researcher called Carlo Brogna who released a paper which showed that in vitro, the SARS-CoV-2 virus can actually infect the bacteria of the gut microbiome. So there's two potential mechanisms that mean that there's going to be this persistent activity of either SARS-CoV-2 or spike protein occurring within the gut microbiome, and that's having an effect on taking down certain keystone bacterial species. And when you start to disrupt that integrity of the gut microbiome and start to bring down beneficial species, you're going to then start to see these interruptions and these problems occurring within the gut-brain axis, the gut-immune axis, and the mitochondria axis, to name but a few. But the research that I've been doing myself, the data that I've been collecting in clinical practice, and just speaking with other researchers, I don't know if you want to share the slide, Binita, so that people can just really see.
First one.
Let's have a look.
Or the second one.
Second one, yeah. So this kind of pulls together all of the information that I've been collecting through studies. And if people want to have access to those studies, I can give you links, Binita, to share later. But this is also a collection of that research and also what I'm seeing in clinical practice. So basically the structure of the microbiome in long COVID seems to be, and I'm calling it kind of a long COVID phenotype, because it's becoming a similar pattern when we're looking at testing and looking at the research. But the general pattern is you see like a low level or a takedown of a species called bifidobacteria, which are really important keystone bacterial species, a good bacteria, what we consider a probiotic. And then we have either really high or really low levels of a bacteria called Akkermansia, and that one's really important for protecting the gut lining. And then we see low levels of a species called Lactobacillus, which again is another keystone bacterial species that's responsible for just the gut-brain axis, the gut-immune axis, and lots of other different functions.
Can I stop you just for a sec, Rachel? When we talk about the gut-brain axis, we are talking about that direct link between the gut and what's going on in the nervous system.
Yeah.
And when we're talking about the gut-immune axis, we talk about the fact that actually the gut is a really important immune organ. So it's extremely important in the immune system.
Yeah.
And the gut can also influence how well our mitochondria function. So you talked about the gut mitochondria. So they are the sort of powerhouses of our cells. So these are, so the balance of these gut microbacteria, sorry, I'm getting all my terminology confused now. The balance of these bacteria in the gut is really important for those pathways to function properly, right? So these imbalances that you're seeing in your patients and in your research, that this bifidobacteria is reduced, that could then have a knock-on effect on the brain, on the mitochondria, on the immune system. Is that what you're saying?
Partly. So it's kind of, it's more to do with the kind of collection of events that are happening at the same time. Because when you have a takedown of these, what I call keystone bacterial species, you kind of leave a gap for some of the more pathogenic or the unfriendly bacterial species to overgrow. Now, I don't like to say this is good and this is bad, because these bad bacteria and good bacteria all live symbiotically together, and they all have an important role to play. But if some of these beneficial bacterial species are taken down and you've got more growth of these negative species, what you have is an endotoxin or a lipopolysaccharide that expresses on the gram-negative bacteria. And these actually get absorbed through the gastrointestinal tract and cause inflammation. So this is one of the key mechanisms. So you end up with, at that point, so the endotoxins, the lipopolysaccharides, and this is quite scientific, but they activate our toll-like receptors, and the toll-like receptors then start to activate all of these immune cascades, which then can spill into all of the things that we're seeing from a mechanistic point of view with regards to internal inflammation, the fiber in fiber formation, the microclots. And then there is some research that's showing that the SARS-CoV-2 virus, or the spike protein, is actually infecting the vagus nerve. So there's a direct route into the brain at that point. So this is really what we're looking at from the gut microbiome perspective.
Also, okay. Sorry, can I just come in here? So I guess to explain that simply, when you've got that imbalance, it's like having weeds in your vegetable patch, right? And the weeds are taking over rather than having the nice fresh vegetables. And that can be because the virus is just actively infecting the cells, or even the bacteria, which is slightly a terrifying thought. And that disrupts that barrier, the barrier between the blood and the outside world. And that's what we call leaky gut, isn't it? So leaky gut means you then get that those tight junctions get loose, and then you can get that inflammation and those bad, I know you said you don't like to use the word bad and good, but say the unfriendly bacteria produce these inflammatory molecules, which can then get through the leaky gut into the body and then cause havoc in more distant organ systems. Absolutely. I know that's oversimplified, but is that kind of
that's pretty much where we're at with it. And some of the research and this is mainly in animal trials where they've kind of been able to discover this, is that certain bacterial species, so these gram-negative bacterial species, can produce things like hydrogen sulfide and methane. And hydrogen sulfide has been implicated in that mitochondrial dysfunction, because it can actually activate with one of the complexes within the mitochondria, which then affects how we produce our energy. So there are some really cool things to dig into when you're looking at microbiome research, when you're looking at mechanisms that are at play.
Yeah, so I think we've kind of skimmed across the surface of some of the stuff that COVID can
this
do,
is really just
very high level. But what I would like to sort of get into is, okay, you could probably chat about the science for the rest of the session, but I'm conscious that our channel is called the Long COVID Clinic, What You Can Do. And this is really about, what can we do about this? So if somebody wants to have their gut microbiome tested, how do they go about that? What are the best tests? I appreciate that they're all different.
They are.
What in your experience, what do you do?
So sometimes I don't test, and that's that can be a little bit controversial, because when I see my clients, I take them through a really intense kind of case history. We go through, all previous medical history. Has antibiotics come in? Have you been breastfed? Were you born by C-section? All of these things will have an impact on the integrity and the growth of the gut microbiome through a lifetime. So if people don't have the funds, because it's really expensive to do the testing, then we can go in with some interventions that have been kind of working within clinical practice, over the years that I've been working. But if people do want to invest in testing, you can do two types of testing. So you can do SIBO testing, which tends to look at the upper gastrointestinal tract, and then you can look at actual stool testing. So there are a number of companies that offer stool testing, and they use various different methods to analyze the stool. So the three that I generally tend to work with will be BiomeSite, because that one's pretty cost effective. And they've also been collecting data on long COVID patients as well, which is really good. But they use the good technology. So they're using kind of what we call RNA 16S RNA sequencing, which kind of gives a really good picture of what's going on from a microbial perspective. But what we don't get from that is details on any kind of yeasts or parasites, or what's going on with regards to digestive processes and inflammation markers. But it is a really good kind of startup test. And generally what people do they'll have that done, and then they come and see me for an interpretation, because this one's actually, it can be purchased by the consumer, and sometimes the results can be a little bit confusing. We then have Genova Diagnostics. So this one is really expensive. You're kind of looking at £300 plus for this particular test. So it doesn't come without cost, but it's using different methods to kind of analyze the stool. So it's using the 16S RNA sequencing. It's using real-time PCR for parasite testing. So it's looking at parasites. It's looking at your microbiome. It's looking at culturing bacterial and microbial species, and then it gives you the antibiotics or the herbal formulas that can be used to try and combat it. And it's also looking at inflammation, blood in the stool, and it gives you an idea of how effective the digestive processes are. So you get quite a good level of information, but of course, high price point. And then there's a company called Your Gut Map, and they're quite new to the market. Again, they're using the RNA sequencing, but they're kind of using AI-based tools, and they're using their research software to allow them to generate the stool analysis, but then develop personalized nutrition recommendations on the top of that. So you not only get the stool test analysis, you get nutrition interventions kind of matched to that stool profile as well. And again, that comes at a higher price point. It's around £250 for that whole package. And again, that's only the Your Gut Map and the Genova, they're only available through practitioner, whereas the BiomeSite you can purchase direct on their website.
Yeah. So if people can afford it, and again, we have to be mindful of cost, but and then they get the results. I think that's sometimes where people get a bit stuck and they don't know what to do about it, and that's where probably consulting someone who understands how to address the issues is probably the right thing to do.
I really I wouldn't put in any, and with consumers, I would be really erring on the side of caution of introducing anything into the gut without consulting with someone, because you can do more harm than good, even with natural supplements.
Yeah. Okay. Let's move on to some of the things that you can do to address the imbalance. There's some questions coming in about MCAS and things like that, and I know that could be that is going to be the topic of another whole hour session. I'm not sure we're going to be able to cover it all today because there's so much to get through. But what are some of the basic things that, if you don't, maybe you've not had your gut microbiome tested and you can't afford to have a one-to-one with an expert, what are some of the basic things that people can do to improve their gut health?
Okay, so first up, save your money and don't purchase probiotics. So probiotics they can be used in specific situations if you've had gut testing done and if you're using them for a specific reason. So there's all sorts of different probiotics on the market, and they're all promising varying degrees of effects. And to be fair, some people do really well on them. So I'm not saying that they're bad, but if you're going to invest your money, invest it in good quality food, fibers, prebiotics. That's what we want. That's what we're seeing in the research is helping to bring back some of these keystone species. If you've still got a little bit left, if they haven't, if certain bacterial species have been wiped out completely, there is a school of thought that they'll never grow back. So you just have to work with the microbiome that you have. But say, for instance, bifidobacteria has been taken down and you've still got some detection in a stool test, or even if you don't do a stool test, prebiotics are going to be your friend. So things like ground flax seeds, fruits, brightly coloured fruits and vegetables, herbs, fruit pectins, things like psyllium husk, avocado, oat bran and chia seeds can be really helpful. And actually there is research studies, so human studies showing that green kiwi fruit, so not the golden kiwi fruit, so the green kiwi fruit can help to do things like stimulate bowel movements, but also help to regenerate the gut microbiome. Things like mango, papaya can all be really helpful. And then resistant starches, they can be quite helpful for people. So resistant starches are carbohydrates that have been cooked and cooled. So when those carbohydrates have actually been cooled down, these starches become resistant, so that they kind of bypass our digestive processes and they go straight to the gut, and then the gut start to ferment it and start to produce beneficial species from that. So people can start to introduce that. So examples of resistant starches would be something like overnight oats, rice that has been cooked and cooled, potatoes that have been cooked and cooled, and pasta as well. I know a lot of people probably are avoiding gluten, but pasta that's cooked and cooled would become a resistant starch as well. And then there's resistant starches in things like our legumes, so our beans and chickpeas and lentils as well. And I try and get people to have about 3 to 5 portions of fruit a day, because fruit contains fiber and polyphenols, which have been shown to help support the growth of some of these beneficial bacteria. So yeah, those are some tips that I can give out today with regards to supporting that. Now, it is a little bit more difficult. I will touch on MCAS and POTS, because obviously MCAS is some people with MCAS or histamine intolerance will react to histamines in foods. So in those cases, it's really best to try and consult with someone who knows what they're doing, so that one, you're not put on a majorly restrictive diet, but two, you're getting all of the nutrients that you need as well. And then for people with POTS who are experiencing like pooling after or gastrointestinal pooling after they've eaten, I do find that limiting the carbohydrates slightly and limiting the sugars and portioning meals appropriately can be quite helpful in those types of scenarios as well. So yeah, MCAS can be a little bit tricky because you can react to certain foods and be absolutely fine with others.
Yeah, no, thanks, Rachel. That's really helpful. And I think anyone kind of watching this who maybe has got a busy life and has got kids and has to manage their own condition, they can feel a bit overwhelmed with the idea of papaya and mango and kiwi and these things that are all quite expensive as well to buy fresh food. It's really challenging, isn't it? It's really, really challenging. And then people like me prescribe like PPIs and famotidine and all of that, which can disrupt the acid of the stomach. And I know nutritionists really hate PPIs. Where's it's so hard to navigate, and I don't think for a moment you're going to have the answer, like the solution for all of those challenges. But where do you sit in terms of the people like me who will prescribe the drugs, and people have lots of faith in people like me and will take the drugs religiously, versus maybe something slightly alternative that you're suggesting? It's hard, isn't it?
It is really hard, but I think I'm a bit of a renegade when it comes to my views on kind of naturopathy and nutritional interventions and pharmaceuticals, because I've seen firsthand, you know, if it wasn't for pharmaceutical medication, my son wouldn't be here today. And I've worked with enough people now to know that actually medications do work for some people, and they can bring a degree of functionality, and in some cases can bring back people's lives. So I would never sit here and say or badmouth any medication. There's always a place to use them. And I think if you are an open enough natural health practitioner, you're going to have the flexibility to be able to work around those challenges. So for instance, if someone is on a PPI, there's still things that you can do to help with digestion and absorption. It is definitely going to be more tricky, and we know that the gut microbiome is altered. There's been major massive systematic reviews and meta-analysis on the disruption of the gut microbiome with the use of stomach acid suppressors, but we can still support the gastrointestinal tract. We can still support digestion and absorption. We just need to be a little bit more adaptable to our approaches.
Yeah, and PPI stands for proton pump inhibitors. These are things like omeprazole, lansoprazole, esomeprazole, and we use them a lot in medicine. I'm using them a lot, particularly if anyone's on aspirin or things like that. We then, you know, prescribe these alongside. So some of those tips, if you're on a PPI and, you know, you want to still aid digestion, is there anything you can suggest?
So just really making sure that you're chewing your food really well, so that it kind of, you are going to get a degree of acid still being produced in the stomach, even with a PPI or an antacid or an H2 blocker, which is the famotidine. That's the one, isn't it? So you're still going to get a degree of stomach acid production, but if it's just making sure that your food's really chewed well, because we do have digestive enzymes in our saliva that help to start the breakdown of carbohydrates and fats. The majority of protein is digested or is broken down in the stomach. So with the PPIs and with the stomach acid suppressors, there may be slightly inhibited protein digestion. There might be slightly inhibited absorption of iron, B12, magnesium, and calcium. So it may well be that those need to be supplemented around it. But, you know, there's always testing available. So GPs can easily run tests on monitoring those particular nutrients as well. But yeah, chewing food really well, just taking time to eat your food can really help. Sometimes some nutritionists will add in a digestive enzyme to help with the breakdown. I've had mixed results using digestive enzymes. They either work really well or there's no real effect at all. But those are some of the things that can support while someone's on those medications.
Lovely. Thank you. That's very, very helpful. And I'd love to get a bit more into the probiotics conversation. But before we do that, you touched earlier on something called SIBO. So this stands for small intestinal bacterial overgrowth. And I think this is a big problem for my patients who have what we call gastroparesis, where the nervous system of the gut is kind of failing because of long COVID and the impact on the autonomic nervous system, and they can't, their gut doesn't move as well. It's sluggish, so they're not absorbing foods very well. Some people even have, you know, a couple of my patients are even NG fed because they've got such severe gastroparesis.
Oh, wow.
Yeah, it's awful. So SIBO, I think, is probably more of a problem than I realised. Can you tell us a little bit about it and what sort of symptoms? I know you're not a doctor, but what sort of symptoms you see in your patients?
Yeah, of course. So small intestinal bacterial overgrowth. I prefer to use small intestinal microbial overgrowth because we might not just be looking at bacteria in this type of presentation, but it's a syndrome that's characterized by an increased number of abnormal bacteria growing in the small bowel. And there can be a number of reasons why that can happen. As you said, slow gastrointestinal time, the fact that the nervous system isn't activating and firing our digestive processes. And it's important to kind of touch on our nervous system here, because our digestion is reliant on our the relaxed part of our nervous system kicking in. And again, in long COVID, particularly with POTS and MCAS, people describe to me that their nervous system feels really activated all the time, and it's really hard to kind of switch that off. Excuse me. But so we have an overlap between IBS, so classical IBS symptoms, and SIBO, because they mirror each other. So both in IBS and SIBO, you're going to get bloating and this kind of distension. So when people eat, they look pregnant straight away, or they look like they've got a big football in their stomach, and it can be quite painful, and that can present with an abnormal pattern of constipation or diarrhea, or you could kind of flip between them both. But really, when you're looking at a SIBO presentation, it's very much the symptoms are more in the upper gastrointestinal tract. So you'll get more abdominal discomfort in the stomach area, you're going to get excess burping and potentially nausea as well. And you don't tend to get that in a classical IBS type presentation.
Yeah. And then treatment is, because there's the medical treatment, what the doctors will do, which is like potentially give an antibiotic called rifaximin, which will then kind of hopefully help restore some of the balance. You would have a different approach in your practice. What do you do for those patients?
Yeah, so I generally, again, I have a bit of an unorthodox practice when it comes to looking at these types of presentations, because in a normal setting, so dietitians and nutritionists may recommend a low FODMAP diet, and that's a super restrictive diet that removes what we call fermentable carbohydrates, which kind of ferment with these bacteria that may be in the small intestine. So it's taking out those types of carbohydrates, and the premise is that that should be a short-term elimination phase while those bacterial species die down, and then there should be a structured reintroduction phase. But what I see in clinical practice from my own experience is that there's problems with adherence to that diet, and also there's not much in the way of follow-up. So people can end up on a restrictive diet for so long, and actually what then starts to happen is not only are you not feeding those problematic bacteria, you're not feeding the good bacteria behind it. So the good bacteria start to decline as a result of the FODMAP diet. And then what can happen is that people can restrict their diet so much. I mean, I've got some people who are just eating 5, they can only tolerate 5 foods because they've been put on a SIBO diet, and they've been restricting and restricting and restricting. And the problem is it doesn't resolve the underlying condition, which is probably nervous system issues. It's the gastroparesis, it's the lack of stomach acid production, and all of those things that are needed to keep these microbes where they should be. So my general interventions kind of touch more on, okay, let's do a food diary. Let's see what foods are potentially causing you some problems. We can look at removing those, but keeping some fiber in. And I totally stay away from antimicrobials, because again, you're going to be killing off the beneficial bacteria. For me, it makes much more sense to kind of grow the good bacteria behind it all, optimize digestion, and then you have a much better outcome with regards to the SIBO. Because even with antibiotics, you'll find that over the course of time, if you haven't addressed the root cause, those species are going, the same presentation is going to happen 6-8 months, a year down the line, and that person is going to be right back at square one again. The other thing that I do want to touch on here is that
absolutely,
all these other nervous system things going on, if we've also all now been introduced to spike protein, whether that's through vaccination or natural infection. And I think if we go back to that hypothesis of viral persistence bacteriophage type activity, unless you get that removed, it's likely that situation isn't going to be improved either. So this is where I would love more research to be focused on, is actually what's happening in the gut from a SARS-CoV-2 perspective and a spike protein perspective, and try and work out what nutraceuticals and interventions can work around that.
Absolutely. And there's so much in there that I'd love to unpack, but suddenly we're at like 20 to, we've got 20 minutes left, and I always try and switch over to the public questions at this point. So I'm going to bring Helen, if Helen's okay, back onto stage to maybe kick off with some questions. Hi, Helen.
Hi. Yeah, I mean, there's an overwhelming amount of information out there, and so much of it seems to be conflicting that as a patient, it seems near impossible to work out, and I think from my point of view, it seems to be trial and error is often the best thing. Is that something that you would agree with?
I think now that I've been working with patients for a number of years now, I think I see a lot more structure to what needs to be done. But I completely agree with you. The internet is a complete minefield when it comes to this kind of information, because you'll go on one site and they're saying, right, you need to, for instance, in the case of SIBO, you could go on an internet website and they're going, right, you need to go with antimicrobials, you need to go on this diet, and you need to do this and you need to do that. And then you've got someone else like myself who's actually worked within this and seen patients on the end stage of all of those interventions going, actually, no, that's not the right way to be doing it. We need to be doing something different. So I totally get that overwhelm. And I think this is where it comes down to the importance of medical professionals and natural health professionals and microbiome experts and nutrition experts coming together to improve those patient outcomes and make sure that the correct information is getting out there.
Yeah. We haven't touched, I don't think, on fermented foods. I know this has come up and it's something that I personally have benefited from a lot, but I know other people, it's really bad for them. Obviously, long COVID is such a huge, and any chronic condition is such a huge umbrella. There is not going to be one thing, one person's poison will be another person's cure.
Of course,
And for me, I have sauerkraut every day now for years since becoming chronically ill. And for me, it works. It stops the flu-like symptoms. But for other people, it's such high histamine levels that it makes them much worse. What's going on there? Why would that be?
So it will just be down to gut microbiome integrity. It might be down to the fact, this is where we can start to talk about things like genetics and epigenetics, because there's certain genetic pathways that are responsible for producing enzymes that break down the histamine in our body. So it could well be that if someone's having reactions to fermented foods, they may not be producing enough of an enzyme called dianamine oxidase, which breaks down the histamine in the gut and basically detoxifies it, makes it kind of null and void. When you start to look at some genetics, you can see that people are not producing that enzyme effectively, so they may have a higher reaction to those types of foods in a histamine intolerance type presentation. It may also come down to the structure of the microbiome as well. It may come down to stomach acid production. So there are, you've hit the nail on the head with regards to one person's poison, another one's cure, for sure.
I may just jump in with a couple of questions, if that's okay. So from Timmy, what are your views on fecal transplants, Rachel? Especially from what you said earlier.
So fecal microbiome transplants, I think it's a watch this space. So they've been used in kind of hospital settings for the Clostridium species, Clostridium difficile, with really good effect. So we've seen as well in kind of lots of animal trials that they are showing to prevent things like obesity and Alzheimer's disease. So the research is really, really quite exciting. Now, the only caveat with it, so some people, one of my patients in particular did a fecal microbiome transplant and got better. Like, it was absolutely amazing. And then she had COVID again, and it completely wiped out the gut microbiome again. So it may well be that although a fecal microbiome transplant might be efficacious, it may not be colonizing, and it may not be improving the actual integrity and the structure and the growth of the microbiome. But I think definitely watch this space, because I think it's going to be one of the only ways we're going to be able to regenerate the gut microbiome if we lose keystone species permanently.
So we've got a question here again from Timmy. Have either of us had a chance to read Super Gut by Dr. William Davis? Very quick answer from me, Timmy. No, is the answer.
No.
Okay, good. Well, that's one for us to maybe look out for. Thanks for that top tip. Okay, and then there's a question here from Debbie about with low histamine regime, and I think you touched on this before, because some people are on some really horrifically restrictive diets. I know some people who are doing water fasts, people are doing all this intermittent fasting. It's a minefield, absolute minefield. I'm sure Helen's probably got something to say about this as well.
It's really difficult.
What do you think about sort of the low histamine diet? Is it is it something that people can do in the short term, or does it just depending on what's going on in your gut? Is that
again, it's similar to what I was saying about the FODMAP diet. You can become extremely restricted, and it can be done. It can be done, and it can be nutrient dense. But sometimes the problem is you can become really hyper focused on those histamine foods. And actually what I found is that some people can tolerate some of those foods and some people can tolerate other foods. So it really does depend on kind of being quite clever with regards to being a bit investigative with regards to it. But any of these interventions, they are short term. They should be done for really no more than 4 to 6 weeks while you work on building back that microbiome structure, addressing some of the issues within the gastrointestinal tract. And again, it's really hard to kind of give blanket recommendations because everyone presents slightly differently. But if you can start to work out what's going on from a gastrointestinal perspective, just by questioning and things, you can really improve outcomes. And I have managed to get a few people not relying so much on antihistamines, doing some of the protocols that we work on.
Brilliant. This one here, does cooled mean refrigerated, or is frozen better?
Frozen, is that talking about histamines? Is it to reduce?
It's still possibly talking about, you said cooled starches, and I think
okay, yes, yeah. So yeah, just cool down. So I recommend sort of about 10 minutes cooling can start to activate those resistant starches. But you can cool them, get them straight in the fridge and eat them no more than kind of 24 hours, really, 12 to 24 hours. I would leave them, particularly things like rice and things, because they can grow not so friendly bacterial species on there.
But to clarify, that's not for the patients with POTS necessarily?
Not necessarily for the patients with POTS, no. Again, it's different. It's difficult to kind of give blanket recommendations because some people with POTS cope with those resistant starches better because they don't release so much glucose into the bloodstream. And we know that glucose release can be problematic in that POTS type presentation.
Another question from Timmy. Thanks for all the questions, Timmy. How does the nasal biome interact with the gut biome? Because I know you're quite interested in mouth microbiome, aren't you, Rachel? What about the nose? Because I'm as an asthma physician, I'm quite interested in what's going on in the nose always.
Yeah, definitely. So from the perspective of the nose interacting with the gut microbiome, I don't know without looking at the research, but I do know that the nasal microbiome is really another important area to be looking at, because some viral replication has been recognized within that oral microbiome. And the interesting component about the structure, or the interesting thing about the structure of the nasal cavity, is that it provides a direct link into the brain. So there isn't a strict blood-brain barrier within that nasal cavity. So definitely a very interesting area of research, particularly when you're looking at when people lose their sense of smell as well. It really shows you that there's that nervous system interaction going on. And then, the oral microbiome, yes, there is a link between the oral microbiome and the gut microbiome. And again, if people are on PPI and stomach acid suppressants, then there is a risk of oral bacteria translocating into the gut. So that has been found. And there's also research as well, particularly in the Alzheimer's space and the cardiovascular space, that oral microbes are found in atherosclerotic plaques. So we know that there is some translocation of bacteria occurring in those particular conditions.
Yeah, and sometimes in the acute setting, there's some studies out there that actually using Listerine and some of those really strong mouthwashes can reduce your severity of COVID and reduce the amount of time you're ill. Presumably, that's terrible for your mouth microbiome. So it's all this conflicting information.
Again, it's thinking that balance, isn't it, Binita? Again, it's kind of like saying that no one thing is good and bad. It's the duration and the length that these things are used for. So if you've got active infection potentially going on within the oral microbiome, then Listerine is probably a very, very sound intervention to be using. And again, when we're thinking about microbial structures, we don't want to be using anything either natural or medicated on a long-term basis that's going to kill off potentially any of the beneficial bacterial species.
I think that's a really important point as well. I don't think enough people are aware that actually mouthwashes can kill the virus multiplying in the mouth and can help you stop infecting fellow whoever you live with or colleagues or whatever stage you're at. I think that's not a piece of information that's not out there enough, actually. Then it's only very limited mouthwashes that do actually do that with the active ingredient.
Yeah, absolutely.
There's a guy called Graham Lloyd-Jones has done quite a lot of work around this and shows that it reduced length of stay in hospital, getting patients to,
great.
Which is great.
Absolutely.
Okay, some quite specific questions coming in. Is there a way to make quercetin more bioavailable? Don't know if you've got.
No, sorry.
On that, Rachel.
I don't know. I probably have got something somewhere that I've got on the top of my head. I'm really sorry. No
problem. I didn't know there was an issue with quercetin bioavailability, but this is why I love these chats because I learn so much.
It can be, and there are, again, you'll get supplements that go, yes, we have a really highly bioavailable form of quercetin. I think there's an isoquercetin that research nutraceuticals do, but I think it's like 90 quid or something like that. And
let's talk about supplements, Rachel, because we didn't talk about it earlier. And every patient at the IT clinic comes in with a list, like as long as your arm, of supplements. I think people are paying thousands of pounds for them, and some things work for some people and other things don't work for other people. And what is how do you sort of tackle that with your patients, I should say?
Oh, it's really difficult. I think this is one of the most difficult things the biggest challenges that I have in clinical practice is that people will read things and they stick with that. And they then end up spending all their money on these supplements. And it's just so sad to see all of these cupboards full of products that are probably never going to be used. So it's just about education, Binita. It's just, making sure that people really understand the mechanisms of these supplements. I really believe that supplements need to be properly regulated. I actually don't think people should be able to buy them off the counter. I think they need to be more in line with kind of how you dispense pharmaceuticals, because I have seen people take certain supplements and it has caused huge flares in people, and it's kind of put them back, weeks and weeks and weeks in their recovery. Likewise, I've seen people take supplements and they've had great effects from it, but it's really something that people shouldn't be playing around with, I don't think. And particularly when you start to look at supplements like nattokinase or supplements that start to interact with medications. So for instance, Binita, you're using kind of anticoagulants, and I don't think people realize that just because something's natural, it can really have a bad interaction with those kind of medications and cause some really serious, it can result in people going into hospital if you're putting in a supplement that's having an additional effect to a medication that's in place. So yes, there's a whole kind of episode that we could do on that, Binita, with regards to drug nutrient interactions and supplements that are being bought. But yeah, and I get it, you know, we're in a situation where we've got a new pathogen that's been kind of dumped on the population. People are really ill. So I 100% get it that people are going to do their own research and have a look at products and invest their money there.
Yeah, and it's not in the BNF for me, unfortunately. You know, when I'm prescribing a drug to go, let's look at the, you know,
yeah, and the list of drug nutrient interactions is humongous, especially when you look at herbs.
Yeah.
When you're buying online, it can be mixed with ingredients that are not necessarily regulated, and of course, it can cause organ damage and all manner of different things. Although, on the flip side, it could help. So it's really difficult. I wondered, what are your thoughts on V9?
Yeah, so I've done a little bit of research with Medicinals 9, and I must say, again, it's one of these things that it's not the cure-all, but it has improved patient outcomes in some people. And I think when I think about the research that these guys have actually undertaken, it is absolutely phenomenal. They have really dug into all of the, you know, as many pathways as you could think of, as many mechanisms. The product itself really works on a lot of the pathways that we're seeing in long COVID. And I think they've just released a new version, actually, which is it's reduced down some of the nutraceuticals that are in it, and they've added some vitamins and minerals to help with the absorption. So they're always kind of looking at improving the product and making it efficacious and safe for everybody. But I've seen some really good results with it, to be honest. Really good.
I think just for people who don't know what that is, the Medicinals 9 has got 9 different compounds in it. And I can't remember exactly what they are, but there's things like quercetin in it, isn't there, and curcumin. But they've been it's been formulated based on the inflammatory pathways we know are problematic in COVID. And I say it tastes like, doesn't taste great, put it that way. But I have got some patients who have definitely really benefited from it, and then others where it just hasn't worked. And that is just life with long COVID, I guess. Until we've got the studies to back it up, there's no way we can make recommendations about these things.
Yeah, of course. But yeah, again, it's
Okay, we've got time for maybe. So time for a couple of more questions. Again, very specific. Can you comment on the role of peptides?
No, I don't use peptides, so I can't talk to peptides, I'm afraid.
Okay, and another very specific question, maybe in the same vein. I don't know if you've got any experience of using this. I've never heard of this, Michael. So again, I'm learning.
Or what was it?
Diosmin.
No, I don't know what that is. I'm sorry.
Okay, good. Well, these are some homework for you, Rachel, to read that book and some of these things. So Timmy's chipped in here in the chat and said he's interested in that particular peptide, because some people say they got much better from it. I think actually, if you look at the long COVID world, every single supplement somebody will have said they've got better from it somewhere, and this is part of the challenge. I don't know, Helen, if you've got any thoughts on that.
Yeah, I mean, it's incredibly hard because, at this point, speaking on behalf of the charity, you know, there's thousands of us as part of the charity, but of course there's millions around the world. And I'm in contact with people from all around the world. I don't even know how many countries I'm in touch with at this point, but a huge amount. And of course, you know, culturally, people will try different things as well, you know, and it's really interesting to learn. But of course, we just, as patients, just want answers. We just want, okay, but what do I do? What's the answer? What is the thing I do right now that's going to make me better by tomorrow? And of course, it's not that easy. So it is a case of trying to find out what is the combination of things for each patient, and therefore what's the most sensible thing to try. And doing that with a professional is key, so that you don't end up doing more harm than damage.
Yeah, and I think it's taking a multidisciplinary approach as well, because there's no one modality that seems to be working in all of this either, and it does need clinicians, therapists, everything to kind of come together and work together with patients as well. And I know that's not an easy task by any means.
Yeah, and it is frustrating that the disciplines are still so separate. You know, that nutrition sits there and a medical doctor sits here, and you know, and I don't think there's that, you know, certainly in the NHS, I don't think it's very integrated at all. I can't speak for everywhere, of course. So I think that really brings us to the end of what's been, it's probably opened up more questions than it's answered, but there are some really, really, no, but I mean, that's often the way with it. And I think when you're trying to tackle something like the gut microbiome in an hour, it's impossible. But there's been some really interesting take-home messages for me, particularly because I think there's just this universal belief that probiotics are good and they'll fix the, you know, take a probiotic and you fix your gut. And understanding that's not necessarily the case, that supplements, if you're not taking them in the right way or the right doses, can actually do harm as well as good. I think there's this thing that, oh, it's supplement, I can buy it, therefore it's absolutely fine. So I'm going to leave things there. So thanks very much, Helen, and thank you so much, Rachel. That's been an absolutely fascinating discussion. We will put some links in the under the YouTube chat. We'll get those up over the next week, hopefully. A few people have asked for the links to Biome site in Genova and things like that.
Yeah, no, fantastic.
And yeah, so I'll be back on the 21st of February. We're having a little break because of half term. With Todd Davenport, who's an amazing physiotherapist from the States, who's done years of research in ME/CFS and now long COVID. And we're going to talk about pacing and use of HRV and safely exercising with long COVID. So I shall leave it there and we'll see you next time.
Thank you.
Thank you.